So I'm going to slowly but surely get started. Welcome back everybody to the lecture series, the ETH and SSPH Plus lecture series. This is public health. I realize that some of you will only just be popping in, so welcome. Some of you may have already been joining us and then you already know me, but if you don't know me, then my name is Emily Reeves. And I am moderating this lecture series on behalf of the Swiss School of Public Health. Maybe you recognize me, not from this series, but from somewhere else, and maybe that's in conjunction with the SSPH Plus Expo project, which you will have heard about if you were clued into the previous lectures, because I was hounding you to download this QR code and have a look at the SSPH Plus at Expo quiz. And the reason why I want to encourage you to do this is because this is a quiz that was developed by faculty members and by students in association with the Swiss School of Public Health. So all across different communities, different cantons, different universities, different institutions, and everybody contributed to give a question about sustainability in relationship to health, and particularly with respect to all the Sustainable Development Goals of the United Nations. So I really encourage you to take a look at that QR code and play around with it. Give me your feedback via email. I'm always happy to hear what your thoughts on that are. As always, I also quickly link in highlighted there some information to support services for students. And I do this because we are, of course, living in very strange and difficult times for our world at the moment. And if you or people close to you have been affected by any of the world's circumstances at the moment, then please don't hesitate to get in touch with the support services available at ETH. But there are similar services across all different universities in Switzerland. And if you need any help in accessing those services, then just drop me an email. You see my email address there. I'm more than happy to help you in any way that I can. Just a short notice for the ETH students who are part of this lecture series at the moment. For this lecture, we have no moderator discussants. As you know, it is a requirement to receive your 1 credit point to be a discussant at least one of the lectures. So if you haven't done that already, this may be your opportunity. So if that's you, then please write to me directly in the chat, and then I can talk you through doing the moderation for the discussion time. So without further ado, it brings me to this week's lecture. So how it works is we will have Dr. Valentina Rotondi talking to us about digital revolution and public health. And after her lecture, we will have time for about 20 minutes of Q&A time. But it's really a pleasure for me to present her to you. She's Dr. Valentina Rotondi. She's a researcher from the University of Applied Sciences of Southern Switzerland and also the University of Oxford. So we are really looking forward to hearing more from you, and I hand over the word to you and also stop sharing my screen so that you can share yours. Welcome, Dr. Rotondi.
Thank you so much for this introduction. Thank you so much for being here, and once more, thank you so much for this great opportunity. Well, I'm more than happy to be here today. I hoped we could meet in person, and I'm sure we will do it soon. So I will start sharing my screen. Yes, let's see if it works. Yes, okay. Sorry for this. Can you see my screen now? Yes, I hope so. Great, yes. Great. Okay, let's see if you can see it. Okay, sorry. Okay, so I will go straight to my talk for today. I know there will be some discussion at the end, but if you have some urgent or pressing issue, feel free to stop me and jump into the discussion. Just a quick recall to you. I cannot see you, so if you have some pressing issue, just open your mic and feel free to stop me. So let's start from the title of today's talk. digital revolution and public health. These are the results of the work I've conducted over the last 6 to 7 years, together with some amazing colleagues from Bocconi University, University of Oxford, and McGill University. Just an outline of today's presentation. I will briefly present what the digital revolution is, and then I will present 2 applications of the impacts of the digital revolution in terms of public health, dealing specifically with the fact that accessing digital technologies can actually have an impact in terms of public health. And then I will present another application in which I will show you that actually also the availability of new data which have been collected through the digital revolution can help us in improving our understanding of public health and how can we deal with the pressing public health issues over our work. And then I will briefly conclude. Just a brief word of introduction. You know that those are public lecture. This is not the presentation of some academic papers, so I will not go straight into the details of the works I will present today, but feel free to drop me an email or write me a message if you want to have some more details in terms of methods used, if you want to download the codes to redo the results I'm showing you today, or if you simply have some other thoughts that will come to your mind later on. So let's start. The digital revolution. What is the digital revolution? I assume you have a mobile phone close to you. Well, mobile phones are really revolutionary, have really changed our way of interacting within societies, of doing basically everything from sending some money to other mobile phones, to tweeting some money to your friends or your colleagues, to call or to text someone living in the other part of this entire world, or simply to get access to information. This is what we mean when we refer to the digital revolution. And the digital revolution has happened over the last 20 years, specifically thanks to the advancement of the technology related to mobile phones, and particularly related to smartphones. Smartphones have completely changed our way of accessing information, also with respect to landline internet connection. 10 years ago, 15 years ago, we were obliged to have a personal computer to get access to the internet, and therefore we were obliged to have a stable internet connection to, for instance, looking at films or having information with respect to, I don't know, the schedule of the trains or the schedule of the buses. But now with this powerful mobile phone, and in particular with these powerful smartphones, we can simply get access to information on the move and whenever and wherever we are. Well, this happened, as I said, during the last 20 years, and let's say the permeation or the diffusion of the technology was really amazing all around the world. If you split this simple graph into different parts of the world, then you suddenly realize that actually, even though the digital revolution, and here in red you see the diffusion of mobile phones, happened, of course, in Europe and in general in the Americas, this happened also in other much more remote parts of the world, and specifically in Africa and in Asia. Today, all across the African continent, we have around 100 subscriptions per 100 inhabitants. Of course, this masks some heterogeneity in terms of diffusion over the whole continent, but also diffusion in terms of rural and urban areas and across different age groups within the population. But still, we have a penetration of mobile phones also in remote areas, which is really incredible and was not thinkable like 20 years ago. So how this has changed also our lives and the society and the economic part of our interaction outside there. Well, if you think that having access to a mobile phone also in remote area means having access to information, having access to banking, having access, for instance, to online schooling, this means a big revolution and a sudden revolution, a revolution that happened quite quickly in terms of penetration. So if the digital revolution had, of course, some big implications in terms of social activities and social interaction and economic activities and economic interactions, also, let's say, in the northern part of the world, for the southern part of the world, this revolution was really amazing. So in my talk today, I will focus on the consequences of the digital revolution, specifically in let's say, in the global south, but I will show you some applications also for some northern countries, especially in terms of data collection, but I don't want to anticipate too much now. So we mentioned the Sustainable Development Goals. Actually, if you take every one of those Sustainable Development Goals, in each Sustainable Development Goal, there is a reference to mobile phone and to internet technologies. Why? Well, because in the, let's say, in the introduction of the last Sustainable Development Goals overview, let's say the main actors of the implementation of the Sustainable Development Goals stated exactly this one, stated exactly that for the SDGs to be realized, poor countries and disadvantaged groups within countries have to overcome what is called digital divides. What do we mean by digital divides? Well, we mean, of course, the divide in terms of both access to the technology itself, what is called first level digital divide, but also to the abilities which are needed in order to use the technology for the good. And so, let's say, exploit or leverage the technology to the maximum possibility available. And then there is a third level digital divide. So first level digital divide, access to the technology. Second level digital divide, access to the abilities or the capabilities which are required in order to leverage the technology to the highest possible, to the highest opportunity ever. And then the third level digital divide, which is not only the ability to have let's say, leverage the technology, but the ability to teach and transform the technology so as to be able to improve our life and lifestyle. Of course, if you imagine also during, for instance, the COVID pandemic, having access to the technology or not having access to the technology had a completely different impact in terms of lives and livelihood. Think about, for instance, remote schooling. If people hadn't access to a nice and good and stable internet connectivity, then also schooling was an issue. And indeed, there are papers showing that where internet connection was unstable, then also schooling was unstable, and therefore pupils didn't reach the correct level of education during those bad times. I already said this, but let's see what the literature tells us in terms of the economic and social implications of adoption. So first level digital divide, adopting the technology. So far, we already have quite an exploding, let's say, literature on the topic. For instance, Acker in 2010 have shown that actually having access to mobile phone, especially in remote areas, could improve market performance. Why? Well, because in this paper, for instance, farmers, but also fishermen can, through their simple phone, can get access to information with respect to the price of crops and the prices of fish, and therefore adapt their strategies in the market. And this improved market performance and market information. Of course, also in terms of let's say, more remote areas, having access to the mobile phone can improve household income, for instance, through the access of mobile money accounts, which are, as you know, the ability of transferring money from one phone to another. What is, for instance, Swint or Satispay, or all these instruments which allow us to exchange money from one mobile phone to another. And this helps people to get access to financial markets where financial markets were basically not existing. Think that today in the global south, more than 1/6 people do not have still access to financial services. Therefore, mobile money can improve also the livelihoods of those people by getting by giving them the opportunity to transfer money from one mobile phone to another. And then, of course, education. Those papers were written just before the COVID pandemic, but think about how important it was to have access to the digital atmosphere or the infosphere, as was defined by some philosopher two years ago, in terms of improved education. And of course, also political participation. This paper in particular by Manaccord and Tesai show that actually having access to mobile phones in sub-Saharan Africa helped people to coordinate during protests and therefore to improve their political participation, especially for the more disadvantaged group. And then, of course, smoothing consumption, because if you get access to mobile phone and therefore to mobile money, you can smooth consumption over time and therefore react to crisis in a much more efficient way. Then there are also evidence in terms of improved migration trajectories, improved gender attitudes, and so reduced gender gap in, for instance, political participation, and also effect in terms of reduction in child labor and school participation. Of course, there is a huge literature showing that actually having access to mobile phone can improve also health services. This paper in particular shows that actually the ability to receive an SMS, a message on the mobile phone, was associated with an increased performance in terms of HIV and malaria adoption and therapy. So you see, the economic and social implication, I wrote it huge here, are really huge, are really extensive. And the digital revolution really have changed the way we behave, interact, and act in our societies. Well, of course, the digital revolution per se have brought also another big revolution in terms of the availability of data. So until, let's say, 15 years ago, we were not thinking about this revolution as a data-driven revolution. Well, you know, when we are online, we leave online a lot of information. For instance, when we go on Google and we type something out on our laptop, then we give Google a sort of high level and high granularity information with respect to what people are interested in, for instance, what people are searching for, where they are searching for some information, and from where they are searching for other information. All this information, of course, can be used for commercial purposes, but can be used also for research purposes, and can help the researcher in building a better theory, a better social theory, but also in addressing important public health issues. Lazar et al. In 2020 have pointed to the importance of social media and of online platforms and digital traces in order to address specifically public health concerns, which require high-level data and, of course, up-to-date data. For instance, digital trace data have been used to study socio-demographic phenomena such as fertility. So, for instance, searches for contraceptive prevalence or searches for how to get pregnant were correlated with the fertility level one year later. But also, for instance, searches for migration were correlated or information with respect to the kind of documents which were needed to allow for official migration were correlated with actual migration later on. And the same happened with health and mortality. So for instance, searches for stroke or searching for diabetes were actually associated with diabetes later on and with the mortality later on. The same happened with gender dynamics. So for instance, the stock of women and men on Facebook, and therefore the gender gap in women and men on Facebook were correlated until the level of granularity of NUTS 3, so like regional level, with gender gap measured by the UN later on. So this is really amazing if you think about that. So those data are available, are in, let's say, 50% of the cases free data, and can be used to inform policies with respect to several issues, including public health. For instance, a paper published in 2013 showed that actually searches for flu on Google were correlated with the dynamics of flu over the last 10 years, with some let's say, limitations. But once you know how to tackle those limitations, then the opportunities behind those data are amazing. So, as I said, there are at least two levels of, let's say, impact in terms of the digital revolution in terms of public health. One is related to accessing mobile phones and accessing the technology itself, which can improve public health concern in real life situations. And the second one is how can we, let's say, leverage or exploit the richness of digital traces in order to inform public health authorities, but also public health research. So let's start from the first one, access to mobile phones and access to the technology. I will show you the result of one paper we published together with some amazing colleagues, to which I'm more than grateful, and which started from, let's say, from an association we found in some data. So we started thinking about how mobile phone can actually shape the dynamics, the demographic dynamics, especially in the global south. And we went through some data collected in Malawi between 2009 and 2015. And we saw that actually, if you take mobile phone use, those were longitudinal data. So women were interviewed at different time span over, let's say, 10 years, because the data actually started before, but we had information on mobile phone adoption only starting from 2009. And we saw that actually there was an association. I'm talking about association for those of you who are like more econometric oriented. Forgive me, I will come to causality later on. Here I'm just showing you some association. So not even correlation. This is a simple plot of histograms, and you see the correlation between owning a mobile phone or not owning a mobile phone over time between different women. And what you see here is that actually for those women owning a mobile phone, let's say that the fertility path was steeper, so was more horizontal with respect to the path of those women which actually owned a mobile phone. And so we started to ask ourselves, but how this happened? Well, we actually realized that the mechanism behind this reducted fertility for mobile phone users, women, was actually related to time spacing of the second and third birth. So it seemed that actually women having access to mobile phone were more able to postpone the birth of the second child once, for instance, they had like realized their goal in life, which was giving birth to the first child. So we went farther into this into this data with focus group and in-depth interview, so with qualitative analysis, and we realized that actually the women were more likely to declare that the transition to the second birth was for them like an issue in terms of going back to work and going back to their, let's say, not household related activities, and therefore women having access to mobile phone were more like able to bargain with their partners the opportunity to use contraceptives to postpone the second birth. So starting from this, let's say this qualitative or correlational associational evidence, we went definitely more in depth, and we started looking at global perspective, and also not only looking at fertility, but on data which were really related to public health concern. And so we tried to provide some large-scale evidence that actually having access to mobile phones could be a vehicle for sustainable development by particularly narrowing gender inequalities, enhancing contraceptive use, and therefore reducing maternal and child mortality. And we provided both global macro level evidence and individual level regional evidence from Sub-Saharan Africa. In terms of data, we used macro level data, so country level data from different data sources, United Nations, UNDP, United Nations Development Program, World Bank data, and International Telecommunication Unit data. And in terms of methods, we applied OLS, so standard regression data, panel data, fixed effect, and random effects model, and then an instrumental variable approach and the difference in different approach. What I'm showing you today are just, as I said at the beginning, just association, because the goal of this lecture is not to show you how methods can improve us in terms of causality, but what are the results of the research. Once more, if you want to know more, feel free to download the paper, which is open access online, or feel free to write me later on. In terms of individual level regional evidence, we used the demographic health surveys, which are surveys collected in more than 55 countries all around 155 countries all around the world. We used data from Sub-Saharan Africa, and we used geolocated data. So we knew the latitude and longitude of the cluster in which the women were living, and therefore we used this cluster information to link the DHS data to the Afrobarometer data, in which we have information, for instance, on the quality of the signal and whether in the same cluster level unit we have, for instance, health facilities or other facilities. And then we linked the DHS data, the Afrobarometer data, to another data to another source of data which is geolocalized, and in particular the gridded climatology data set, in which we have information on, for instance, the rainfall in the local geographical unit, so in the cluster level, or also like drought and whatever is related to climate, okay? And then, last but not least, we linked those data, those geolocated data, to the nightmare imagery data set by the NASA and ASE, which contains information with respect to the number of flashes which fall in the local geographical unit each day. And why this was important? Because of course we wanted to address, like, see whether there were some correlations between having access to mobile phones and maternal and child mortality and contraceptive prevalence, but we wanted to go one step further and try to assess the issue of causation. So whether having access to mobile phone was causally related to those outcomes. And therefore, in terms of methods, we applied multi-level methods, but also an instrumental variable approach. where we actually exploited the fact that there was a slower adoption of mobile phones in local geographical units, 10 kilometers areas, in where lightning strikes, so flashes, lightning strikes, are more frequent. We were not the first one using this IV strategy. This strategy was already used in the paper by Manacorda and Tesei that I presented before, but the two papers were published around the same time. And also we used the information with respect to mobile phone coverage, which was in the Afrobarometer. So we combined two different IVs, slower adoption of mobile phones in areas where lightning strikes were more frequent, together with information with mobile phone coverage, which we retrieved from the Afrobarometer. This is a map of the women, and in red you see the areas where the lightning strikes are more pronounced between 1995 and 2003. And here you see also, I don't know if you can see it. Okay, we can zoom in, and you see that actually the green dots are the dots where adoption is higher, while the white dots are the dots where adoption, the areas where adoption is lower. And you see that actually where flashes are higher, so where light strikes are hit higher the floor, which are the red areas here, also mobile phone adoption is actually lower. Of course, unless you get a flash on your head, this should not be related to maternal and child mortality, and so it is a good candidate for an instrumental variable approach. So I go straight to the results. Once more, I'm just showing correlational results, but as I said, in this paper we have some instruments which help us in assessing the causality. And here are the results. At the global macro level evidence, we show that actually having access, using data from 219 countries from 1993 to 2017, we show that the mobile phone diffusion is negatively associated with the global gender inequality index all across the globe, with a higher contraceptive prevalence, with lower maternal mortality, and with lower under 5 mortality. When we split across different level of GDP penetration, or so on quantile of GDP penetration, or sorry, of GDP growth, we show that actually those who benefit more from the increased availability of mobile phones are the poorest country in the most deprived areas. And this is true for gender inequality. So let's say gender inequality is reduced more in countries, in poorer countries. Contraceptive prevalence is increased more in poorest country. Maternal mortality is decreased more in poorest country. And of course, under 5 child mortality is decreased more in poorest countries. Well, you might wonder whether the size of the effect is indeed relevant or not. And it seems that it is, because increasing mobile phone diffusion has a slightly stronger effect in reducing infant mortality with respect to increasing GDP per capita. This means that actually the size of the effect is quite the same, okay? This means that actually increasing mobile phone has the same effect, or almost the same effect, or the same association with respect to increasing GDP per capita. It seems it's relevant. The size of the effect is indeed relevant. And once more, increasing mobile phone diffusion compares to a 1/3 increase in GDP per capita in terms of reduction in maternal mortality, which is once more around 0.004. Let's go to the individual level evidence. Here we took only those countries for which we had DHS information at the cluster level with the information, with the geolocalization, and also the information with respect to mobile phone. For those of you who are interested in this kind of topics, now much more, many more DHS includes information with respect to mobile phone access, mobile phone use, and also internet use, and the typology of internet access and mobile phone use. Let's go straight to the results. What we show is that actually, both in terms of probit or OLS and multi-level analysis, but also in terms of instrumental variable, the women who declare to have access to a mobile phone have a higher probability to be to declare that they are also the women, the one within the couple who can decide whether to use or not contraception, the one who say more often that they can share decisions with respect to health with their husband, who are more frequently also users. They can decide, but they are also user of modern methods of contraception, which are crucial in terms of reduction, for instance, of HIV prevalence. And indeed, they have a higher probability of knowing where to get an HIV test. Their children were with a higher probability tested for HIV as a part of antenatal care, and their children had at least one antenatal visit. Once more, you may wonder whether the size of the effect is indeed relevant. And indeed it is, because the estimated coefficients are sizable. As for most outcomes, the effect of owning a mobile phone is roughly comparable or even bigger than that of living in an urban area. For those of you who are familiar with the development economics literature, this is really an important variable in the models. If you look once more at let's say the wealth of the regions, here we have the wealth quantile at the 10 per 10 kilometers area, and indeed you see that those who benefit more from mobile phone penetration are those coming from a lower level of development. So those living in most of poorly area, those living in the poorest area are also those who benefit more from having access to the technology. So what we have learned so far? First of all, we have learned that actually getting access to mobile phone or putting mobile phones in the woman's hands can causally increase women empowerment, improves women's sexual and reproductive rights, reduces maternal and child mortality, and therefore, in a nutshell, leveraging mobile phones can actually be a way to attain sustainable development. There is always an however, and these however's looks like that. There are still a high level gender gaps in accessing, and also first level, second level, so in the ability and then in the sharing of the technology itself. And there is also gender gap in use, how men and women uses the mobile phone or even smartphones or even internet in different parts of the world is highly different. And this brings some completely different results. So we said at the beginning, well, this digital revolution can be a really digital revolution because accessing the technology can have impact in terms of public health, but also because the technology itself produces some kind of data which can be used for research in terms of public health, but also in terms of improving public health. So I will present you today the results of a research in which we have used those data during a global public health crisis, the COVID-19 pandemic. So, sorry, here, okay. I go straightly here. So in this paper, which was realized during the first lockdown, so at the very beginning of the COVID-19 pandemic in Europe and specifically in Lombardy, so in northern Italy, we wanted to understand the dynamics of trust in science and expert during the pandemic. Well, why? We wanted to do it in real time as the high impact epidemic of the coronavirus, COVID-19, unfolded in Italy. And we wanted, therefore, to use real-time data And to use real-time data in that specific period was not possible unless we were able to collect those data through digital traces. And therefore, we used actually digital traces and the survey experiment collected from 3 online platforms: Twitter, Telegram, and Facebook. Okay, as I said to you before, digital revolution can have both impact in terms of access, but also data, can have an impact specifically in the global south. But what I'm showing you now is that this impact can also be, yes, 10 minutes, in the global north, let's say. Okay. So why this is relevant? Because trust in science is particularly important in times of epidemics, because the variables linked to trust in experts and in institutions are important correlates of citizen compliance with public health policies, restriction, and guidelines. And also because sustaining trust can be challenging in times of uncertainty and risk. A lack of trust in healthcare providers, for instance, during the Ebola crisis in West Africa, was shown to be associated with the fact that affected families were less willing to bring their sick members to the hospital. So and at the same time, crises themselves can affect trust and trust in authorities. So it is not only that trust is essentially a prerequisite for compliance and willingness to accept the rules and regulation, but it's also the fact that actually the crisis themselves can change trust. And if trust changes during a pandemic, then this means also that compliance can change. And this is this could be an important public health concern. Of course, the evidence is limited and often mixed, and usually it comes after the event. But we wanted to understand the dynamics of trust during a crisis, so when the crisis was underway. So we had some hypotheses that were actually pre-registered. So before data collection, we registered the hypotheses, and those hypotheses were that actually during a pandemic, trust should have followed a sort of reverse U shape, in which trust was growing at the beginning of the pandemic and then going down. And then we had some simple hypotheses such that trust is positively correlated with better knowledge, and also that trust in science, those who have a higher level of trust in science are also those who are more receptive to information and therefore more compliant. We went through these 3 different social media platforms: Twitter, Telegram, and Facebook. We downloaded all the tweets, geolocated once more related to coronavirus, specifically in Italy, because we were at the beginning, the real beginning of the COVID-19 pandemics. And then we made this repeated opt-in survey on the COVID-19 channel on Telegram. We reached more than 60,000 people, and we had 4 waves. So this was a longitudinal data analysis. And then we went through Facebook. We used the Facebook IPI, the geographically target recruitment via the Facebook ADS. And we perform a survey experiment. To the survey experiment, we applied then post-stratification weights. What is a survey experiment? Well, the survey experiment is something like this. We ask people on a scale from 0 to 10, how much do we agree with the following statement? And we had 4 different statements. Are young people also at risk of contracting the coronavirus? And then to some people, we gave the information with the source of the information. So stating that this information came from the Italian Institute of Public Health. To other people, we simply say, older people are those with pre-existing medical condition and they are as affected. They can have a higher medical condition, but they have the same probability of being affected by the coronavirus. So we randomized completely randomly those who received information with the source of the information and those who didn't. And we did this survey on a geographically targeted area for which we have granular information on the number of people infected by the coronavirus at that specific time, and we followed them over time. Those were the 4 treatment arms, or the 4 treatment manipulation we used. Well, quickly to the results, we actually saw that there was indeed a reversed U-shape in terms of trust in science, specifically where the diffusion was lower and where the diffusion was extensively high. Zero to no effect where the diffusion was stable over time. And this is more evident from this graph here. And also, this was stable across different data sources. So we had this in Twitter here. We have this here in the Telegram survey, which was a longitudinal survey. And this is also evident when we apply an OLS and we control for sub-regional level information. Of course, we might also skip this and go simply directly here. The second question was, well, okay, trust evolves during the pandemic, but is this associated with higher compliance? The answer was yes. The higher the trust, the higher the compliance. And so the third question was, well, can we help people in change their opinion with respect to the coronavirus? And if we give them the information with respect to, let's say, reported by the experts, should we see in the data, and we randomize the information, recall this, should we see in the data that people are more willing to update their beliefs when their beliefs are wrong? Well, the answer was surprisingly not. So when at the end of the first pandemic period, we gave people information with respect to the coronavirus, and we stated that this information came from experts, since the U-shape was already coming to the end of the distribution, people were less likely to update their beliefs when their beliefs were wrong with respect to the coronavirus, when they received information from experts, with respect to them when they received information from non-experts. So straight to the conclusion, because my time is now over. So we see that actually both Twitter and Telegram point to initial increase in interest in scientific sources, with larger increases in areas affected later. Over time, there was an erosion of trust, and this erosion of trust was indeed one of the main causes of the fact that people were not willing to update their beliefs when their beliefs were wrong and when they got information from scientific experts. So really 2 words as concluding remark. First of all, the digital revolution can improve the life of people and can improve public health, especially in remote areas, but the digital revolution can also help us as researchers, as a public health experts, when we want to deal with public health concern in real time. So thank you so much for your patience, and I'm happy to have your inputs and comments.
So thank you very, very much indeed for your very interesting talk. It was very, very interesting indeed. And of course, you spoke so passionately, so we were all very glued in. So thank you for sharing. As I mentioned before, there's now time for Q&A. So this is where I open up the floor to anyone who has any questions or any comments. Please feel free to just unmute yourself and ask a question directly. Otherwise, you can also write in the chat and I will read out the question. So if somebody has a question to open the floor with, then I invite you to unmute your microphone and ask the question now.
I will do it if you permit. Yes, thank you a lot for the presentation. It's rather not question, because honestly, there are so many things. I think it's just give me the ideas, you know, some other topics. Or so I just wanted to ask you if you or maybe colleagues you're working with.
Sorry, Katerina, you are muted.
Now it's better.
Oh, it's gone. No.
Yeah. My comment would be, with this idea of the digitalization and effect on public health, you know, we're living through this difficult pandemic time, and also the problem with vaccination. Yeah, we saw a lot. I mean, I personally was impressed how many people would be anti-vax, and in my head, while you were presenting those very interesting papers and analysis, I had an idea. Do you think it could be possible to look into which would be more European central or developed already countries on, I don't know, the access to digital information and their negative perspective on vaccination? You know, this angle. I don't know. I'm just thinking it would be very interesting, because we know that there are a lot of false information or wrongly presented information, and it's also digitally transmitted. Yeah. So roughly, I'm saying that you're presented as that the digital, you know, the positive effect of digital revolution, which I imagine is huge. Yeah, but that would be also, this example would show also that some wrongly used digital tools would have negative also effect on the public health. Yeah, it's actually not question, you see, sorry for that. It's more like a discussion.
Thank you, Caterina. Thank you for this question discussion, because you went straightly to the point. So, as I mentioned before, of course, there are also dark side of the access to the technology. Just to cite a few, there are papers showing that actually having access to mobile phone reduces life satisfaction, because this reducing the quality of in-person relationship, and this is related to reduce life satisfaction in the end. There are also papers, of course, from let's say the global north and not from the global south. There are also papers showing that on the other side, having access to mobile phone reduces loneliness in the adult population, because this helps them in reconnect with people when they have to spend longer time in isolation. In terms of vaccine excitancy, there is indeed a project which is now, let's say, on the field with some colleagues, in which we actually use the word value survey. And so, and the word value survey were actually fielded in some countries during the pandemic. And the word value survey have information with respect to where people get access to information usually, so on a daily basis, so whether from the mobile phone, internet, or whatever, and then their level of trust in science. And there is a question specifically on whether vaccines are good or not, okay? And it seems that there is indeed this, let's say, negative association with the vaccine proneness, and so a positive association with the vaccine excitancy in the global north, while in the global south is still, the effect is still positive. So it seems that what you have in mind is exactly what it is also shown in the data. There are other papers. One of those is really, really interesting. I don't remember if Larson is the first or the third author, and whether Kashyap is the first or the third author, so forgive me for this, in which they actually show that once more mobile internet use, and so getting information only through the mobile phone, was associated with a reduction in compliance with the social distancing measure during the COVID pandemic.
Thank you. Could I take then the question from Andre Lopez, as I see that you raised your hand?
Thank you. Can you hear me okay?
Yes.
Perfect. I am not, first of all, thank you so much, Dr. Rotondi. It was a very interesting, very engaging presentation. I am not sure if I can properly formulate what I want to know in the form of a question, but there's been a lot of discussion when we think about other types of technology, for example, access to energy sources, of how the developing countries could avoid some of the pitfalls that the westernized world had to deal with. And I was wondering, from my understanding, the digital revolution seems to be happening at the same time everywhere, since it is so explosive, even though there are those barriers in terms of access that you mentioned. But I was still wondering, do you find any sort of patterns or things that maybe we've done with this digital revolution that we could avoid in those developing countries as we develop their infrastructure so that they can access that sort of technology? I'm thinking things like, social platforms that were used to be unregulated and then that are now being regulated for fake news and all that. Are there any other things that you think that we could maybe avoid for those developing countries?
Thank you, Andre. Thank you so much for your question. This is really another crucial point, okay? I don't have, let's say, a full answer for this topic, which deserves much more than a brief discussion. But for instance, in several developing countries, social media platforms started already to be regulated since the beginning. Think about China, think about India, think about Kenya, think about Guatemala, okay? In those countries, social media platforms have started since the beginning to be regulated, and I don't know whether this was good or bad in terms of outcomes, but of course, they started already from a different path. The same happened with the control over the market, for instance, of the telephone cards, which in our part of the world was also almost free since almost the beginning. It started quite early to be free and not controlled, while in other parts of the world is still controlled, and so you have one or two providers. So it seems like there is the digital revolution happening at different time speed, I would say, but all across the globe. But still, there are differences which will, of course, bring some consequences differently in different places. I know that this is not the answer you deserve, but I'm sorry, it's the only one I have so far.
I totally understand. Thank you.
So maybe then I can take the next question from Nicola Matucci.
Yes, thanks. Thanks, Valentina, for your nice presentation. You were able to present really a condensed view on ICT and the world. So very ambitious one. On the first paper, I have a comment. On the second paper, I will ask some proper questions concerning the methodology. The first paper, my comment, it's indeed a positive comment because as you were mentioning just now, mobile phones are not the panacea across the world. Correctly, you applied the test where these technology are assumed to reap the highest benefits because of a lack of alternative infrastructure, lack of basic standard of living. So it makes sense. In Western countries, actually, we face the downturns of digital revolution, especially mobile technology. What are the disadvantages of mobile technology? It's a proprietary technology. You cannot modify or modulate it. You take or leave it. So think, for example, the privacy issue. Think the market power. In most countries now, you cannot access a bank account not having a telephone, a mobile telephone. This constrains the market freedom and the privacy release degree you want to have. So market power matters in a larger country, but this does not apply to your paper, which is correctly devoted to the greenfield development of the technology. Let me pose the question about the second paper. Actually, it was on Italy. So the survey and everything was related to Italy.
Actually, it was related to Lombardy because it was fielded during the first 3 weeks of the pandemic in Europe, which were basically confined to Lombardy and the Swiss-Italian part.
Yeah, probably you should have had more time to explain the methodology. So I beg your pardon if my question is too pretentious in the short time you had to present it. Actually, there may be interactions between technology or information sets and trust in institutions. So there's no unique dependent variable. What is independent may become interdependent. So institutions and media are cyclically dependent on each other. So we cannot do really a sort of causal line going from information, knowledge, human capital, and trust in institution, because it's likely to be in terms of how to handle the pandemic, what kind of health policies to enact for the pandemic. I will say that your story will be very nice for, let's say, countries where the cycle between trust and institution is positive. We know that in Italy we had in the past, and also now, troubles in ensuring that politicians receive the amount of trust they deserved, because there were circuits. Think about the media in Italy, which is one of the lowest country in terms of media freedom, and lowest in Europe. I mean, then across the world, no. And so I think we need to build a more critical, problematic, causal framework, but this doesn't take away the value of your analysis. Probably having more time, you would have explained the limitations of the analysis. I didn't read the paper, so perhaps what I'm saying is completely irrelevant, no, given the paper. But think for a fact, for example, the fact that nowadays, at a certain point in the survey, you mentioned antibiotics. I remember 2 years ago, the Istituto Superiore di Sanità claiming that antibiotics were scientifically unuseful for the pandemic. In the last 2 weeks, new papers published, scientific papers, reaffirmed instead the importance of antibiotics for COVID, because COVID is a bacteriophagous virus. So in 2 years, the scientific knowledge, the scientific authority was completely reverted. So we are navigating across very unstable fields. So I thanks for your venture, because it was very courageous. Probably to extend it to other countries will be another piece of evidence to strengthen the explicative framework. Thanks a lot.
Thank you, Nicola. I have 1 minute to reply, correct? Can I reply in 1 minute? Just, okay. So just for you to know, we remade the same survey experiment, which is an experiment. So the causal claim here could still hold, because the randomization within the survey was ensured, while not for the Twitter and Telegram path, because there we didn't have any causal analysis, just a correlational analysis. So we remade the same survey in Spain, France, and the UK, and also in Italy at different time span. Now we are in the process of analyzing the data, so for after 4 waves and different countries. So thank you, Nicola. Thank you so much.
Thank you very much to all for this very, very interesting discussion. And of course to you, Dr. Rotondi, for sharing with us your expertise. It's been fantastic to have you, even if only virtually. Now, of course, we have unfortunately run out of time, but it was great to end on such a lovely and interesting discussion. For those of you who do follow the lecture series, then short information. This was the last lecture before we do a short break, and then eventually have the final lecture on the 1st of June, and that will be taken by Dr. Stefan Culati on You Are What You Have Done Throughout Your Life, How Reliable Our Life Course Influences on Healthy Aging. So if that sounds interesting to you, then please tune in for that. But in the meantime, enjoy your break. And thanks once again to all of you who took part, and to Dr. Rotondi. All the best and have a nice evening, everyone.
Thank you a lot, Valentina.